Welcome, everyone, to Boost Summer Learning Experts. My name is Muna, and I'm the Education Engagement Specialist with PBS Wisconsin Education. I manage different engagement events with young ones and their families around the state, and I'm be able to be moderating this webinar today. We have a wonderful panel of people who are here to share their expertise, tips, and tricks with you all, and let's dive in. And for those of you who just joined us, a reminder to please turn off your audio and your video just so that we can have a smoother quality. So we are going to start off with a keynote by Dr. Marcia Slattery, and she's going to be talking about anxiety and stress in the home. What does it look like, and what should we do? We are then going to go into our breakout session presentations, which many of you selected already during your registration via Eventbrite. So many of you have already been pre-assigned to different rooms and should automatically be in the different rooms when that time comes. And then we'll have a closing keynote by my wonderful colleague, who will be talking about different resources. And the title of her presentation is Learning Powered by Curiosity. And we will finish it up with a panelist Q&A. So thank you all so much for joining us today. And if you have any questions or comments during Dr. Slattery's presentation, feel free to utilize the chat box. So let's get started. Dr. Marcia Slattery, thank you so much for taking time to be with us today. As I mentioned, her presentation is Anxiety and Stress in the Home. What does it look like, and what should we do? Take it away, Dr. Slattery.
Great. Well, thank you so much for allowing me to join you today. This is a wonderful panel and obviously a very important topic. So Mona's going to help me with my slides today. What I really want to address is that anxiety and stress is very common and very common in the home, especially during all of this time of change. And so my goal today is just to share with you some key points about what this looks like to identify it with kids in your home and with adults as well, and some pointers about what to do, or some pearls, if you will, about how things may go and what may help with that. So if we could have the next slide. So I'd like to start out by just saying, well, how do we describe what anxiety is? Because a lot of people have different interpretations and different understanding about this. These are some of the words that I often hear about from both kids and from adults. I feel anxious, I have worries, I'm afraid, I'm fearful, there's a sense of apprehension, I'm stressed. That's all very common words. And the one point I wanted to bring up with this is when you're talking with kids, especially about are you anxious, or are you feeling anxious or fearful? It's very important to check with them if they understand what you're talking about. So, for example, in my office, I'll say, do you know what it means when people say they feel anxious? And many of the younger kids will look me straight in the eye and say, I have no idea. No, I don't know. And then I'll say, do you know about what it feels to feel nervous? Some may notice that. Others may say, I know what it's like to feel afraid. So find the word that works for them, because it's going to be different, especially for the younger kids, so that they then have a working model about what you're talking about. Next slide. So that's what we talked about anxious. Stress and anxiety are very intertwined. So it's a little more interesting when I say, well, what is stress? And interestingly, the most common response I get to that is, I'm feeling anxious when I'm feeling stressed. And what's interesting is people sort of have a model, if you will, a working model about what it means to feel stressed. If you just look at the next slide, here you can see some very common depictions of stress in the news media over the past recent years. And you notice on the far right there, lo and behold, anxiety. So my point is, when people say they feel anxious or stressed, they're sort of one and the same. If you go to the next page, next slide. And we say, well, what is stress? Well, what I also like to do is make the point about there's good and there's bad stress. And if you look at really what's the technical definition of what stress is, it's a real or perceived, and those are put in italics because sometimes it's how our brain interprets things rather than an actual threat. But somehow our brain is perceiving that there's a threat of some sort to the person. And there's a response to that, typically physiologically as well as psychologically. So in determining is it good or is it bad stress, there are two elements that we look at. How much control over the stressor does the person have? And what are the resources that the person has? And can I deal with what's being ahead of me? So stress can often happen. We go back to school, that's going to be a stressor for every kid because there's more demand. There's more that's being asked of that child. Good stress is when we actually have stress that pushes us forward. So that's important when we're learning, we're problem solving, etc. Bad stress is when we feel we're on overload. In other words, the demand outstrips the resources that we feel like we have in order to deal with that stress. But the point is, some stress is actually good, whereas when we feel on overload, that's really when people start to say, I'm really feeling stressed out. Next slide. So I think of it this way, like a coin. Anxiety on one side, next slide, and stress on the other. Next slide. So two heads of the head and tail of the coin, if you will, that these two go hand in hand. And just to keep that in mind as I'm talking for the rest of this talk. Next slide. So what triggers anxiety and stress? So we kind of have a working model. This is what it means to be stressed. The key thing that will trigger anxiety and stress is uncertainty, or as many of my patients will tell me, I don't like not knowing, not feeling ready, not feeling prepared, and not feeling like I have control over what's about to happen or what I'm going into. So remember that uncertainty is really the driver for a lot of the anxiety and stress that people experience. Next slide. So what triggers uncertainty? Why does that arise? Very common triggers of uncertainty are when we have change in anything familiar. And in particular, if we have change in a routine or a schedule, if kids are expected to do something new, and especially if it's sudden and it's unplanned, if there's changes in the environment, like there's a lot of noise, there's less order, like a chaotic environment, and if there's loss of familiar people. Should be support. That next word should be comfort, validation, like from parents, teachers, coaches. So when we've got things that just basically change our day, that contributes to a lot of uncertainty. And uncertainty, as I mentioned, contributes to anxiety and stress. Next page. So here we are in COVID-19. Uncertainty, all of the above. Loss of schedule and routine at school, at home, loss of familiar people, our teachers, the childcare, relatives, friends, peers, coaches, environmental change, home now instead of school or at a childcare setting, stressed family members everywhere. Kids aren't sure what to do because they don't have their routine. Parents are home, many of them that I'm hearing about, with a tremendous amount of job stress because they're expected to continue to work full time while also being teachers and taking care of the kids. So we're going to talk a lot about that today. And losses of sources of what I say accountability and validation. For example, in school, the kids know they do something, they get a lot of validation for what they've done. So there is accountability and validation and feedback that's very important for them to learn. So COVID-19 certainly has disrupted many things that are familiar. Next slide. COVID-19 also presents with risk, which is another trigger for uncertainty, right? We hear about illness and death, and it's contagious. We've these new phrases and new concepts of social distancing and isolation. Suddenly everyone's wearing masks. We can't even see each other when we do see people out and about. And kids are also seeing these panicked adults, for example, in the grocery stores. So they're seeing this all around them. They're hearing about it on the news 24/7 about risk and death and ventilators and all the hospitals, etc. And the hard thing, I think, for everybody, especially at this point into all of this that we're experiencing, is there's not an end date. There's not a time that this is going to end on such and such a day where we can look forward to then going back. It's still very ambiguous. And ambiguity also contributes to that feeling of uncertainty, which contributes to feeling more stressed. Next slide. So how does this manifest in the house and in the home? Well, it's going to depend somewhat, many times, on the age of the kid, which also correlates with brain development, particularly frontal lobe and ability to self-regulate. So in younger kids, many times they're not able to identify specific worries. That's not uncommon. But they will experience tension. And the way I describe it, it's like a rubber band that gets stretched. When that gets stretched, it's more like this, and something hits the rubber band, it pings pretty good. These kids get really tense inside, so something goes wrong. They're irritable. They have what parents will call meltdowns. There's a reactivity to them. Their randomness, they're more impulsive. Parents will often say, and other kids as well, like, I feel like I'm walking on eggshells because this kid gets angry so easy. Bottom line is they have a lot of difficulty with self-regulation. That might include some physical elements like hitting or throwing things onto others or on themselves. They have a lot of difficulty with attention, often gets misdiagnosed as ADHD, and they get distracted, and they can be very oppositional and resistant. So when you look at that list, it doesn't sound like the usual list that we think of with anxiety, like I'm worried and I'm nervous. A lot of it with the younger kids are these negative behaviors that are much more related to dysregulated behavior and emotions. Next slide. In teens and adults, you can get some of that as well, but sometimes it's a little more subtle, if you will, not quite as much of the acting out, but it can be acting out in other ways. So again, they may or may not identify the worries. They definitely still have the tension because that's the physical part of anxiety. And there's still that irritability and anger. They get more impatient. There's lower frustration tolerance. And the other piece that's really interesting more with teens and adults, you get more avoidance and procrastination. Like, yeah, I just haven't gotten to that yet. Or no, I don't want to do that. I'm not getting anything done anymore. That procrastination is avoidance, which is a cardinal feature of anxiety. And some kids and some adults, withdrawal as well. Next slide. So what does that all contribute to at home? A very tense household, and I'm hearing a lot about that these days. Family members are on guard. They feel guarded. Family members very reactive. They're irritable. There's arguments, there's frustration, and there's acting out. And I would put another very important point on this, that this also contributes very importantly to a risk that we need to really monitor closely for abuse, including domestic abuse, child abuse, and elder abuse. So all of these elements can be a powder cake, if you will, within the home. Next slide. So what do we do? Well, one of the most important things we need to do is learn to communicate with one another, particularly how we're doing, how we're feeling. This doesn't mean we have to get telling everybody about how we're feeling, etc. But it does mean that when people are feeling angry, when they're feeling more irritable, it's important to let other family members know. Like, use a code word, for example, some families do, or they just say, I'm feeling more angry, I need to take a time out, so that other individuals know and can understand what that person is feeling. So communicating, teaching kids to use words for their emotions. What are you feeling right now? Use a word so that they can get used to using that word, whether it's angry and irritable. Also get them used to using words for happy or anxious or nervous or whatever other emotion they're feeling. We often use in what we call an emotion or feelings thermometer, and this is something that's in many different formats. And I always recommend to families put it up in your home where they can see them and say to the kids, all right, point to me where you are. Let's say for anger, how high are you on this thermometer about how angry you feel right now? I'm a 4, I'm a 2, I'm a 7. It again helps them cue into exactly what they're feeling and to be able to communicate that, which in and of itself helps with regulation. Secondly, have a plan about what to do if they're feeling upset or angry or frustrating, what I call a calm plan. For example, I'm going to go to my room and I'm going to do one of these following things. So I recommend to parents make a list of 4 or 5 things that help this child calm down. Write it out. I'm very big on writing stuff out because in the moment we don't think about things, we don't remember things. Very important to have it written out. It's a cue card and have it posted somewhere in the child's room. So you could say, go to your room and look at your calm list. It goes directly to that. Our brain can zero in exactly on what to do and engage in one of those, which will help to bring down that level of dysregulation and agitation. Next slide. So the other thing that's really important, I talked a bit about before about how the uncertainty definitely triggers the anxiety and the stress. So we need to build in a sense of certainty. There are a lot of things with this experience that we cannot control. And what we really need to focus on is what we can control, i.e. that sense of certainty, particularly within the home. So we want to find a degree of certainty, predictability, control, and where we're going to get our support. Next slide. Most important in many, many houses is to develop a routine and schedule. What's going to be happening today and when, and post it in a very simple form somewhere that's very easy to see in the house, like on the front of the refrigerator, on the child's door, somewhere. So when they're walking around, they see it. Not that they're going to stop and study it each time, but as they're walking by, their brain will notice it, and just noticing it will feel like, got it, we've got a plan for today. And that in of itself will decrease anxiety a great deal. In our brain, basically what happens when we have things that make us anxious and there's uncertainty, it scans, as I described, the database. How did we do this before? What's going to happen? And if it feels completely novel, there's nothing there for it to grab on, and that's what causes the anxiety. So when there's predictability, and yes, we know how to do this, we've done it before, that sense of familiarity brings things down a great deal. How does it help? We know what's going to happen. We know what's expected. You know who's going to be there. You know where it's going to happen, and you feel ready for it, and you feel more in control. So you're now taking something that might be a bad stress or a difficult stress and bringing it down to something that's more manageable. Next slide. So what to do? A daily schedule can be very helpful. Again, make it visual and post it. These are the categories. This is just a suggestion that I use with a lot of my patients. I say use these 4 categories: physical exercise, what I call brain exercise, that's like school and learning time, social time and activity or fun time alone or with your family or your friends. I also am big on writing lists. Trust me, I'm not like making these kids make lists all day long, I promise you. But these cue cards help a lot because it's objective and it's immediately present and available to them for reference. So you now have these 4 categories, and you're going to put it on a schedule, and you're going to say, okay, this is your time for physical exercise. And the first thing they're going to say to you is, well, what did I do? I'm bored. So we want to make a list. Next slide. Here's an example of a schedule. Again, you're going to do blocks of time where you're going to try to get these different categories in. Next slide. And here's what I call the menus. Like I say, I go to the restaurant, I don't always know what I want. So I look at the menu, and then I'm reminded when I see it, this is what I want today. Here's an example. Here are things that I could do for brain exercise, physical exercise, social time, activity with when I'm alone or with my family. Again, having this visually and posted somewhere is a good reference for kids to use. Next slide. So when you're doing the brain exercise, just one point about this, because I have a lot of parents that are saying, hey, I got to work. I got a WebEx and I've got another Zoom meeting. I can't be with my kid. What I recommend is break it down into blocks and have a specific task or a goal in each block. Don't say, okay, I want you to work on your homework till I come and check on you. It's too vague. Say, here's the 2 worksheets I want you to do, or I want you to color these 3 pictures for me, and I'm going to come at such and such time, so they know when you're going to come. And stick to that. Come back, give them the accountability and the validation for what they've done. Really give them a lot of acknowledgement for the process of following through this plan rather than the success of it. Visual, again, is very good, especially for younger kids. So it might be a sticker for that part of the schedule. A lot of parents like to do like a jar, and they'll throw in a colored poker chip or a cotton ball, something where you say you did it, and they put it in, or earning points. Have a motivator for these kids, a positive reward system that motivates them to say, I'm buying into it. There's some reason for me to do this. If I do this, here's what is in for it. And you're validating that process. Next slide. What about screens? Very, very common question. Here's my take on it, what I often talk to parents. Think about the healthy plate. Kids know about the healthy plate. There are these 4 categories of food: protein, fruits, grains, and vegetables. Dessert is not on the healthy plate, as much as kids would like to think that it is. But we like dessert, and that's good, right? Next slide. Here is probably what I hear most of the time, what I think kids' version of the healthy plate is. In other words, let's just have all the desserts, if I had my choice, and I would put everything else into that 25% category. Obviously, adults are making a better choice, that we've got to have these other categories, and we add on the screen like a dessert. It's extra. Next slide. So again, up on the left, you'll see here's what the kids typically would say. Here's what I think my healthy plate would be: screens and everything else in small proportions. But think about it as a healthy plate model down on the far right. This is really what you want to target. You want that physical exercise in there every day: physical exercise, brain exercise, social time, activities, and hobbies. Prioritize those things, and adding the screens on last as dessert. These other categories are extremely important. Now, that's not to say you can't use screens in some of those, but that's what we're going to talk about in a minute, where you want to monitor it. I'm talking about like hours on YouTube or gaming or things like that. So make sure that you're doing a lot of non-screen time. Next slide. Bottom line, a lot of increased screen use, I guarantee you, is increased problems. Many, many studies showing this. More anxiety, more irritability and anger, problems with attention and focus, sleep problems, more sedentary, obesity. Very important to moderate and monitor screen use, and emphasize physical and hands-on activities. I call it cross-training for the brain. When you're doing these other things, it really makes other parts of the brain work, which increases flexibility and focus and attention. Next slide. Other thing, in addition to monitoring, have the kids use it in a common area of the home. Designate very clearly screen-free time, including meals or family meetings, and screen-free zones. No electronics in the bedroom. I used to say, oh, we'll try it, but I've learned over the years it doesn't work. Have all electronics out of the bedroom, the bathroom, etc., other areas that are designated in the home. Next slide. Importance of talking and time together. Make time to talk each day. Make it part of the routine. One of the most common things I hear from parents is, my kid won't talk to me. And then I say to them, well, how often do you talk with them? And quite frankly, it's typically, well, every now and again, or if something comes up. Well, when it's not routine, we're not likely to get much information. If I talk to someone every 3 months, I may hear about weather and job or things like that. If I talk to someone every day, we cut to the chase and we talk about things that are meaningful to each other. That's going to be exactly the same thing that happens if you're trying to talk to your kid. Spend time every day just being present, to listen to them and say, how'd your day go? What's new? Just let them talk. If they know it's going to happen, you're likely to hear about it. Meals, drives, bedtime. Right before bedtime, take a folding chair, sit in there for 5 minutes, and they know this is going to happen. And just say, how'd the day go? What do you want to talk about? It might be you talk about a past favorite vacation you had, whatever. The important thing is do it every day. Plan time together. If they're doing brain exercise or schoolwork, be a study buddy. Sitting with your kid and doing things that are similar to what they're doing is very calming. Exercise together. Family meetings, I really recommend these, especially during this time of being home together. Just a short check-in at night. It might be at dinner or afterwards, and say, well, let's talk about how'd the day go. Give positives to each other. What didn't go so good? And what do we want to plan for tomorrow? Have that communication. Next slide. Finally, I also want to talk about parent stress. Be aware of your own stress and anxiety. And yes, kids do know very clearly when you are stressed. I hear about this all the time in my office. I know my parents are stressed, I can tell. And they'll give me many different good examples. They're like a sponge. They're going to soak it up even more than their own level of stress if they pick up that you're stressed. So monitor that. When you're with them, try very hard to have an objective, supportive role, model supportive, problem-solving approaches, and use your adult support networks for your stress. You do need an outlet, but don't use your kid for that, because that will stress them even more. Next slide. Other family stress management approaches: exercise, very high on my list. Get outside, do things together. It goes a long way for psychiatric and physical and social, emotional, etc. It's good across the board. So in summary, anxiety and stress responses are common. Communication is key. Develop a plan and routine, just some consistency in your day. Have flexibility. Do the stress reduction things alone and as a family, and enjoy the time together. It really is a gift in many ways. Thank you.